In pharmaceutical dosage forms, when it is being utilized for individual for therapeutic purpose, essentially there are a couple of steps involved here. And the dosage forms we are taking inside either through oral route or intravenous route. The drug molecules at the end is reaching into our bloodstream, and from the bloodstream, it is going into site of action, the particular locations where the receptors are going to interact, bind, and then we'll have the measurable response, the effect of the drug. So when we're talking about the entire route from dosage to blood and from reaching site of action to the effect, observation of the measurable effect for the individual, there are two parts. One is known as pharmacokinetics, another is pharmacodynamics. So pharmacokinetics is essentially the migration of the molecule, concentration of the drug, and the dosage form, how it is absorbed. Basically talking about the mass of the compound, particularly drug, in dosage form to blood, how the concentration profile in plasma is going to change, how this drug molecule is getting removed from the body. All those aspects are considered in pharmacokinetics. Pharmacodynamics, on the other hand, is talking about what is the concentration we have in the plasma and what is the measurable effect. Because many times we can have the concentration is low or concentration is increased. Measurable effect may also increase proportionally or may not increase. So this relationship is essentially known as dynamic. If I talk about the drug in our body system looking like a compartment model, we're talking about the drug molecule coming through gastrointestinal tracts, which is going into our portal blood, bloodstream, blood and lymph. Some drug molecule can go through liver and again come into our blood main circulation, which can also be providing the vascularization into GI tracts from the main compartment of the blood, which can directly also molecule can come through intravenous route, intraperitoneal route, subcutaneous route. So different mode drug is coming into, and the drug can be dissipated or losing through is through kidney, bladder, urine, through lungs, alveoli, and through expired air. It is what is we are going to during respiration. Drug molecules can also go out. It can move into some extracellular fluids. It can get deposited into fat. It can also be deposited into different organs. It can also come as a secretion like sweating. It can also happen. And similarly, some undigested drugs from the oral route can also go into feces. So we are showing here how the molecule is coming, what is the molecule going out, just making our systems into different compartments and connections. Now, when we are talking about the drug in our body, particularly we are talking about the plasma bodily fluid, drug is coming through absorption process. This is a free drug. Free drugs can move there into particular receptor. They can interact. They can bind. It can goes into tissue. They can also bind for long time reserves. Along with the circulation, some plasma protein also they can bind. Some of the drug molecule can get transformed. So it is basically irreversible loss of the drug. Though the receptor bindings we are talking as a reversible, and the free drugs can also go into excretion. So basically, excretion depends on how much you have free drugs. Free drugs actually determine how much it will be bounded. So basically, if there is any loss of drug from your compartment of the central compartment, the binding from free bound form can also be reversibly release those drugs. So they're all in a balance. So increase will cause increase into the other domain. Similarly, decreasing concentration will cause the drugs to come into the systems back. So we define the terms as bioavailability because when you are using some dosage form, how much molecule is going inside the system and how much dosage is there. So for intravenous, the bioavailability is 100% because whatever amount of the drug you are injecting, all of them are actually reaching your systemic circulation. But in case of non-IV route, oral, dermal, many times what will happen, drug molecule may not be completely absorbed in GI tract. Some of the drug molecule can be also be broken down in gastric environment. some molecules also go through first pass effect because the drug is directly going into liver rather than going into our central circulation. So they can also get transformed there. So bioavailability, the reason can be drug can be destroyed in gut, not absorbed, destroyed in gut wall, or even destroyed in liver. So these are the laws. And of course, there is some excretion will be there as a result. Remaining portion is going into systemic circulation, and finally, out of that, it will also be lost. For drug taken other than any IV route, bioavailability, we need to understand all molecules, all proportion of the drug will not come. So we need to understand how much fraction is actually bioavailable, reaching into systemic circulation, reaching into target sites. For the elimination aspects, there are four important compartments like liver, it is metabolism, kidney also filtration and secretion, and lungs also exhalations. These are minor anyway, and other secretions can also happen, mother's milk, saliva, minor loss. But kidney and liver can do the major loss of the drug elimination from the body. Elimination can to happen to kidney, we already know, depending on different parameters, size constant of the molecule, binding with the protein, conversions, acidification, alkylation can also be doing, and their metabolism is also their role in minor loss of kidney. And same way for the liver also, it can also depending on availability of the drug. And we also many times we also refer that drug can also go into liver, and that is through portal circulation. They can have glucuronide conjugations, and bile can also come into bile duct to gallbladder. This is the route enterohepatic shunt because some of the amount is directly going into liver route. Now, if you see the drug concentration in plasma monitoring with sight, we can see after we are ingesting the drug through oral route, at the early phase, the drug will be absorbed. So, drug is mostly going into your systemic circulation. So, systemic circulation concentration is actually increasing. In that time also, elimination is started, but basically the concentration is increasing because the rate of absorption is much higher than rate of elimination because drug concentration is very low. But then they will reach a peak concentration where absorption and elimination rates are equal. Then we'll have a steady fall. In that time, elimination is the main key player. It doesn't mean that the entire drug has completely been absorbed. Still, absorption can continue, but elimination rate is much higher. So overall, there will be loss of drug to the system, and plasma concentration will also decrease. Here, one important things we'll be discussing is in case of volume of distribution, because you need to understand if I'm taking a drug, some maybe 300 milligram of dosage form, 100 milligram may be lost in our GI tract, and 200 milligram is reaching in your bloodstream. If I assume that we are having around 5 liter of blood, so we can think that okay, 200 milligram is there, 5 liter of blood, so concentration will be 40 milligram per liter in plasma. But things are not so simple. Even if you are assuming blood is just 5 liters, but if we consider the other fluids or maybe the water content in our body, so this is also drug can also move into tissue, fluids, and different other organs, and then some cases they can be concentrated there, so large amount is going there. So essentially in blood, even if the total drug we have added or was 200 milligram, 200 milligram may not be there. They have already migrated in some other organ, deposited, concentrated. So if I measure the concentration, concentration will come much lower. For example, it may also be there that concentration can be much higher because probably it is not going to be distributed properly into the plasma. So we have a apparent volume of distribution is how much amount of drug in our body divided by concentration in plasma. So ideally, VD value will be equal to the volume of plasma concentration if all drugs stay in our body. But if the amount of drug is high, but concentration is low, that time our VD value will be higher, volume of distribution can be higher. That means we are equating to the fluid volume, which will make the same concentration. So VD is basically volume in which drug appears to distribute as a concentration equal to plasma concentration. So what does it mean? It actually reflects how much drug is going to be distributed across the different bodily fluids. Like here we are talking about plasma, tissue, concentration. So VD is never equal to the volume of fluid you have. So assume here 100 milligram drug, plasma volume is just for example 4 liter here. So plasma concentration is basically 20 milligram per liter. So what is the problem here? Because 100 milligram drug and plasma concentration is just 20 milligram per liter. So volume on theory is coming that 5 liter, but your plasma volume is just 4 liter. So we can have VD is more than plasma volume. All compartments are in equilibrium. If concentration drops in plasma, concentration will also drop from any other compartment. This uniform and instantaneous distribution is assuming like a oil stirred mixing system in one compartment model. So plasma is the main compartment and it is going to distribute into different body parts. Here also one example we are talking about, like we are having some drug, if we add some charcoal, charcoal will concentrate the drug, resulting in the aqueous phase concentration much lower. So it behaves like the same in case of plasma. We have the drug total amount in plasma, but some organs may concentrate them too much. So apparent concentration in plasma will be low. So volume of distribution will become much higher. So VD values for some drug can actually tell us whether the drug has any preferential movement into some particular organs, or maybe it is more soluble in fat, like that. So like here we are showing a few drugs here. You can see in some cases we can have two different concentrations. For example, 0.16 liter per kg, and another case VD is coming 11.2 liter per kg per 70 kg of body weight. So this much liter volume is suggesting. In another drug, it is suggesting phenotine 44 liter. Here is 38.5 liter. What does it mean? When the VD value is too high, it means that drug is getting concentrated into some organ. Plasma concentration is much low, so VD volume is much higher. So partitioning of the drug into body or bodily fluid or tissue can be suggested.